Good morning. You're listening to Bhavini Makwana on BHF radio on this Saturday, 21st November. It's just turned 10 o'clock. I hope you all are having a lovely morning so far. Happy belated Sal Mubarak to all those who are celebrating Diwali and Nutan Varasno Abhinandan. Hope you got to celebrate the best that you can. I know it was slightly different to the way we would normally celebrate, but I hope, you managed to celebrate and enjoy last weekend. Today we have got a few guests on. We're going to be talking all about diabetes, diabetic retinopathy, which is the eye condition that you can develop if diabetes is not maintained or managed carefully. But the importance of having retinal screening appointments and attending them, to catch signs early of hopefully preventing sight loss. We're going to be talking to two medical experts, and we've got Nita joining us from Leicester, who'll be sharing her experience living with type 1 diabetes. But it's also Jalaram Jayanti today. So first of all, we're going to play our first song dedicated to Jalaram Jayanti, and hope you enjoy this track.
जलाराम बापा जय जलाराम वीर पूर्णावासी बापा जय जलाराम
जय जलाराम बापा जय जलाराम वीर पूर्णावासी बापा जय जलाराम
जय जलाराम बापा जय जलाराम वीर पूर्णावासी बापा जय जलाराम
जय जलाराम बापा जय जलाराम वीर पूर्णावासी बापा जय जलाराम
हे गोकुळ बनाव्યું જેણે વીરપુર ધામ વીરપુરનાવાસી બાપા જય જલારામ વીરપુરનાવાસી બાપા જય જલારામ
जय जलाराम बापा जय जलाराम वीर पूर्णावासी बापा जय जलाराम
હે ભક્તિ અનેરી જેને ભજ્યા છે રામ વીરપુરનાવાસી બાપા જય જલારામ વીરપુરનાવાસી બાપા જય જલારામ
जय जलाराम बापा जय जलाराम वीर पूर्णावासी बापा जय जलाराम
હે દર્શનમાં જે આનંદય પાર વીરપુરનાવાસી બાપા જય જલારામ વીરપુરનાવાસી બાપા જય જલારામ
जय जलाराम बापा जय जलाराम वीर पूर्णावासी बापा जय जलाराम
હે પરમ કૃપાળુ કરુણાના કરનાર વીરપુરનાવાસી બાપા જય જલારામ વીરપુરનાવાસી બાપા જય જલારામ
जय जलाराम बापा जय जलाराम वीर पूर्णावासी बापा जय जलाराम
ઓ દયાના દાતાર બાપા કરે બેડો પાર વીરપુરનાવાસી બાપા જય જલારામ વીરપુરનાવાસી બાપા જય જલારામ
जय जलाराम बापा जय जलाराम वीर पूर्णावासी बापा जय जलाराम
હે પરચા પૂરા છે જેને જગમાય પાર વીરપુરનાવાસી બાપા જય જલારામ વીરપુરનાવાસી બાપા જય જલારામ
जय जलाराम बापा जय जलाराम वीर पूर्णावासी बापा जय जलाराम
હે દુઃખ હરનારા દેતા સુખ નારે દાન વીરપુરનાવાસી બાપા જય જલારામ વીરપુરનાવાસી બાપા જય જલારામ
जय जलाराम बापा जय जलाराम वीर पूर्णावासी बापा जय जलाराम
ઓ સંત સેવાધારી બાપા બોલે રામ રામ વીરપુરનાવાસી બાપા જય જલારામ વીરપુરનાવાસી બાપા બાપા જય જલારામ.
જય જલારામ બાપા જય જલારામ, વીર પૂર્ણવાસી બાપા જય જલારામ.
હે નવખંડમાં જેના ઉજળા છે નામ, જેના ઉજળા છે નામ, વીરપુરના વાસી બાપા જય જલારામ, વીરપુરના વાસી બાપા જય જલારામ.
જય જલારામ બાપા જય જલારામ, વીર પૂર્ણવાસી બાપા જય જલારામ.
હે દુખિયાનો બેલીનો ધારાનો એ આધાર, નો ધારાનો એ આધાર, વીરપુરના વાસી બાપા જય જલારામ, વીરપુરના વાસી બાપા જય જલારામ.
જય જલારામ બાપા જય જલારામ, વીર પૂર્ણવાસી બાપા જય જલારામ.
હે વીરબાઈ સંગે શોભે જોગી જલારામ, શોભે જોગી જલારામ, વીરપુરના વાસી બાપા જય જલારામ, વીરપુરના વાસી બાપા જય જલારામ.
જય જલારામ બાપા જય જલારામ, વીર પૂર્ણવાસી બાપા જય જલારામ.
હે ગ્વાલ હૈ નામ એક બાબા જલારામ, એક બાબા જલારામ, વીરપુરના વાસી બાપા જય જલારામ, હે વીરપુરના વાસી બાપા જય જલારામ.
જય જલારામ બાપા જય જલારામ,
જય હો
વીર પૂર્ણવાસી બાપા જય જલારામ.
એ જય જલારામ બાપા જય જલારામ, વીરપુરના વાસી બાપા જય જલારામ.
જય જલારામ બાપા જય જલારામ,
બોલો
વીર પૂર્ણવાસી બાપા જય જલારામ.
That was Jai Jalaram, and hope you enjoyed that. Like I mentioned before that bhajan, we have a couple of speakers on today's show, so let's go straight in. Today, first of all, we're going to be speaking to Dr. Sheena George. Good morning, Dr. Sheena.
Good morning. Good
How
morning,
are you?
everyone.
Morning. Would you like to introduce yourself?
Yes, I'm Dr. Sheena George. I'm a consultant ophthalmologist, and I specialize in conditions which affect the retina, which is the camera film of the eye, and one of which is diabetic changes at the back of the eye. I also lead the diabetic eye screening program in northwest London, which is one of the largest programs in the UK. And I also take part in national and international clinical trials in the treatment of diabetic changes in the eye. And I'm just going to talk about, in summary, how diabetes can affect the vision and how common it is, the importance of identifying and treating these changes early on, and the importance of having your eyes checked regularly if you're diabetic. I'm also, in the UK, we have the diabetic eye screening program and why we started it, and also how you, as a diabetic, can prevent these changes from happening or getting worse. And if it gets to this point where it needs the help of an eye doctor, what we can do to help treat these changes and prevent vision from getting worse. So, first of all, how diabetes can affect the vision. Diabetes, as most people know, is a condition that affects all parts of the body, especially every blood vessel that runs throughout the body where there's high levels of blood sugar in it. And how it affects the eye is that it makes the blood vessels on the camera film of the eye very prone to leaking and not functioning, not working properly, which means that it can cause blurring of the vision and sight loss. So the importance of identifying it early is that we can prevent the changes, if they're noted early enough, by changing your lifestyle as regards diet and exercise. And one of the reasons for implementing or putting in place the diabetic eye screening program was to spot the changes early, and every diabetic over the age of 12 has pictures taken of the back of their eyes every year. And these photos are looked at very carefully by trained technicians, and if they spot any changes that need the help of a hospital doctor, they will refer the patients into the hospital for assessment and possible treatment. So that is the reason why it is important to have the eyes checked every year if you're diabetic, to make sure that you don't have the changes that need treatment, or if you do, it can be given to you early enough. So how can you prevent these changes happening or getting worse? As I alluded to before, the mainstay is to change the way you eat in your diet to try and reduce the amount of sugar and carbohydrates. We have wonderful resources on the internet. In the UK, we have a website called the Diabetes UK website that includes recipes and also assesses, if you're not diabetic but have a risk of becoming diabetic, a tool to assess the risk of you becoming diabetic. And all you will need is your height and your weight and your waistline measurements, and you can get an immediate risk of you being developing diabetes. So it's important, whether you're in the UK or anywhere around the world, to if you can, to look up this website, Diabetes UK, and you'll find a wealth of information on how to help deal with diabetes and even prevent it from happening. The other topic I was going to talk about was how can these changes be treated by an eye doctor in a hospital. If it gets to the stage that you need treatment, there are wonderful treatments now. One of them involves injections of medicine into the eye through the white of the eye. That can sound quite scary, but it is better than going to a dentist, and it improves the vision by reducing the changes of the diabetes at the back of the eye. In those changes, you get leakage of fluid out of the blood vessels, which distorts the anatomy of the camera film of the eye, which means it can't work properly. And these injections will dry up the fluid and help the anatomy to return back to normal.
Sachi beauty pageant and inspiring Indian women too. Voiceover
That part of the eye can function normally. Other treatments are laser treatment, which will help prevent new blood vessels growing, which is one of the consequences, the later consequences of diabetic changes at the back of the eye. And the reason we don't like new blood vessels growing at the back of the eye is because they're much more fragile and likely to bleed and cause problems in that way. So, have I got any more time, Bhavini?
Yeah, and just a quick question. So, the effect that it can have on your vision, is that risk to both type 1 and type 2?
Yes, absolutely. 90% of people have type 2 and only 10% have type 1. But in the UK, diabetes is responsible for 5% of all sight loss in this country. And more than 1,700 people have their sight seriously affected by diabetes every year. So that's 30 people every week. And it is one of the leading causes of preventable sight loss, so it can be stopped from happening. And that is why the diabetic eye screening program was started in the UK, and it's been a huge success because we've managed to reduce the cause of sight loss in the working age population. It used to be the most commonest cause, and now in the UK it no longer is, whereas it is in other parts of the world. Not only that, diabetes makes you more prone to getting glaucoma, which is a condition that causes damage to the nerve that connects the eye to the brain, and you're more likely to get cataracts, both of which can lead to sight loss. So hence the importance of picking up diabetes early. If you haven't got diabetes, assessing how much at risk you are of developing it and discussing that with your doctor. If you're in the UK, you can access this risk tool. I've done it for myself because I have a family history of diabetes. And if you're in England, you can actually get a free place in one of the National Diabetic Prevention Programs to help you prevent you from becoming diabetic. So that is the most important message, is to try and prevent diabetes. And if you have diabetes, try and take as necessary steps to reverse it with the help of your family doctor.
So you mentioned that you have a higher chance of developing diabetes because it's prevalent in your family. And we often hear that people from ethnic backgrounds, Afro-Caribbean, Indian, South Asians, how true is that? Is that a true fact that we're more prevalent to getting diabetes?
It's all in the family history, and it is very well known that ethnic minorities have a stronger family history of diabetes, and so it is a true fact, unfortunately. But it doesn't mean that you will get diabetes. Even though you're more risk of it, you can take preventative measures and basically not develop it. And if you do, you can obviously try and reverse it as well, which is one of the key research areas that a lot of diabetes research is now focused on.
Yeah, and you mentioned earlier it's not just sugar, it's not just the sweet things, it's carbohydrates that you need to be careful of. And it's basically,
I think it's a misconception that it's just sweet things that you should avoid. Any carbohydrates that quickly break up in your body can be absorbed as sugar into your blood. So it is very common knowledge that any white carbohydrates, such as potatoes, white pasta, white rice, white flour, is because it's so refined, can easily break up, be digested in your body and be absorbed as sugar. So the key is to have more brown carbohydrates and in moderation. So it's slowly broken down and only slowly gets absorbed into your body.
Yeah, I mean, the items of food you mentioned, that could be a typical of an Indian dish, couldn't it? Like
Absolutely.
Potato, curry, rice, chapati.
Yes, totally. And obviously all the Diwali sweets that I hope most people have tried to control.
Yeah, no, definitely. Thank you, Dr. Sheena George. We do have a few questions and we'll come back to you a little bit into the programme. But it's, thank you for highlighting actually that it is very important to keep a check on your sight because, attending your retinal screening appointments can detect things early. And if it is picked up early, there's good chance that you can prevent sight loss. And actually, diabetes, we often think that it's, avoid sugary things, chocolate, sweets, biscuits, all that kind of stuff. But in fact, it's carbohydrates. And I think that's a very important message to get out because not many people have that perception of knowing that, refined white products can actually quickly turn into sugar, which can have an impact on your sugar levels as well. So thank you for sharing that. We're going to go to a track and then we'll be joined by Nita from Leicester. So the next track, Barish, is...
So the next track is a song called Ek Din Bik Jayega from the artist Mukesh. It's an old classic.
एक दिन बिक जाएगा माटी के मोल जग में रह जाएंगे प्यारे तेरे बोल एक दिन बिक जाएगा माटी के मोल जग में रह जाएंगे प्यारे तेरे बोल तुझे के होठों को देकर अपने गीत कोई निशानी छोड़ फिर दुनिया से डोल एक दिन बिक जाएगा माटी के मोल जग में रह जाएंगे प्यारे तेरे बोल ला 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 अनहोनी पथ में कांटे लाख बिछाए, होनी तो फिर भी बिछड़ा यार मिलाए। अनहोनी पथ में कांटे लाख बिछाए, होनी तो फिर भी बिछड़ा यार मिलाए। ये बिरहा ये दूरी दो पल की मजबूरी, फिर कोई दिल वाला काहे को घबराए। करम पम धारा जो बहती है मिलके रहती है, बहती धारा बन जा फिर दुनिया से डोल। एक दिन बिक जाएगा माटी के मोल, जग में रह जाएंगे प्यारे तेरे बोल। ला 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 ला। पर्दे के पीछे बैठी सांवल गोरी, थाम के तेरे मेरे मन की डोरी। पर्दे के पीछे बैठी सांवल गोरी, थाम के तेरे मेरे मन की डोरी। ये डोरी ना छूटे ये बंधन ना टूटे, भोर होने वाली है अब रहना है थोड़ी। करम तम सर को झुकाए तू बैठा क्या है यार, गोरी से नैना जोड़ फिर दुनिया से डोल। एक दिन बिक जाएगा माटी के मोल, जग में रह जाएंगे प्यारे तेरे बोल। तुझे के होठों को देकर अपने की कोई निशानी छोड़ फिर दुनिया से डोल। एक दिन बिक जाएगा माटी के मोल, जग में रह जाएंगे प्यारे तेरे बोल। ला 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 ला।
So now we're going to speak to Nita Kochela from Leicester, who actually has type 1 diabetes. Nita, welcome to BHF Radio.
Thank you.
Would you like to introduce yourself, and also at what age did you develop diabetes and what was it like?
Yeah, sure. So I got diabetes when I was age 10. And I hate telling people my age, but I've had it for 40 years. So calculate it if you really need to. So yes, I was age 10 when I developed it. Type 1 diabetic. And in those days, all those many years ago, it wasn't that common, especially in children. My poor parents were shocked with how can a child be diabetic, but some of the symptoms were there, but they were not discussed. Google wasn't around in those days. Doctors weren't aware of child diabetes, too much GPs in those days, so it was a struggle trying to get the doctors to take my dad very seriously in terms of there's something wrong with my daughter.
What was it like for you? Like when you were first told that, you've got diabetes, like did you, at the age of 10, like did you understand it, or what was it like?
because I said it was quite a while ago, I'll tell you what I actually remember.
Yeah,
I didn't
sure.
have a clue what they were talking about, they being the doctors and my parents. But the one thing I do remember, in those days, we used to have health visitors that used to come to your house. And they used to come and give me my insulin, and insulin is taken via an injection, basically. And they used to come and give me my insulin in the morning so I could have my breakfast, and then they would come back at dinner time and give me my insulin. They did this for about a week, and then the following week, oh my God, they said to me, you need to take the insulin yourself. Now, I'm a 10-year-old child, and I'm like, I am not putting that needle in me. And they're like, that's fine. If you don't have breakfast. I'm like, I don't care. A few hours later, I'm crying because I'm starving.
Yeah.
And it all started from there. That's when I realised.
Nita, we have lost you. I don't know if you've pressed mute by accident. Whilst we get Nita back on with us, we're going to play our next track.
So the next track there.
Nita, are you back?
So the next track there is Pal Pal Dil Ke Paas, and I'll play that now.
पल पल दिल के पास तुम रहती हो, पल पल दिल के पास तुम रहती हो, जीवन मीठी प्यास ये कहती हो, पल पल दिल के पास तुम रहती हो। हर शाम आँखों पर तेरा आँचल लहराए, हर रात यादों की बारात ले आए, मैं सांस लेता हूँ तेरी खुशबू आती है, एक महका महका सा पैगाम लाती है, मेरे दिल की धड़कन भी तेरे गीत गाती है, पल पल दिल के पास तुम रहती हो। कल तुझको देखा था मैंने अपने आंगन में, जैसे कह रही थी तुम मुझे बांध लो बंधन में, ये कैसा रिश्ता है, ये कैसे सपने हैं, बेगाने होकर भी क्यों लगते अपने हैं, मैं सोच में रहता हूँ, डर डर के कहता हूँ, पल पल दिल के पास तुम रहती हो, जीवन मीठी प्यास ये कहती हो, पल पल दिल के पास तुम रहती हो।
And that was Pal Pal, remixed by Mohammed, I think it was, wasn't it?
Mohammed
Yeah.
Afan.
Okay, so we've got Nita back. Technology can't be helped. So Nita, please do carry on. So you're 10. You've just found out you've got diabetes, and you're talking about taking insulin injections yourself. Do you want to continue? And for those that may not know, like what those insulins are and why you need to take them, are you able to explain that?
Yeah, I should be able to. So this is the way it was explained to me, and I'm sure if the two doctors later want to add to it, they may do. But type 1 is where your pancreas doesn't work at all. So if you're a non-diabetic, you're not diabetic, when you eat, your pancreas releases insulin.
Oh, we've lost Nita again. Dr. Sheena, do you want to take over just
Yes.
by explaining?
So when you're type 1, your pancreas is not able, the cells that produce insulin have been damaged irreversibly and cannot produce insulin, so you cannot produce insulin yourself, and that is the hormone that helps regulate or control blood sugar in your body. So type 1 diabetic patients have to take insulin by injection into their body. It cannot be controlled by tablets as you can in type 2. And type 2 diabetic is when your pancreas does work, it can produce insulin, but maybe not enough for the needs of your body, or that the insulin isn't as effective as it used to be. And that's a condition called insulin resistance. So it is producing insulin, but the insulin isn't working as well as it should. And that's when you can have tablets that will help improve the insulin effectiveness. And if that's not enough, then you may have to progress to having injections of insulin if it's not controlled just on tablets.
And Nita mentioned that she was age 10, and is it common for younger children, younger teens, and to develop type 1, or can anyone develop it at any stage?
It's very unusual to develop type 1 after teenage years. It tends to occur after a flu-like illness, and the thinking is that it's due to a virus infection destroying those particular cells called the islets of Langerhans that produce the insulin. It's a very mild flu-like illness that may not even cause major symptoms. Did anybody else want to come in there?
Yeah, this is Subhash. I just wanted to mention that I've got a friend whose daughter actually developed type 1 diabetes at the age of 2.
Yes.
Oh, okay.
Yeah.
Well, welcome, Subhash Uncle. Would you like to introduce yourself for our listeners?
Okay. My name is Subhash. I'm a clinical pharmacist by profession. My area of work is in eye drops and especially glaucoma, dry eye syndrome, etc. I have a background of working in diabetes about more than 12 years ago. So I'm quite familiar with type 2 diabetes. And I'm married into a Patel family, and the whole clan is type 2 diabetic. So I'm quite aware of what goes on here. Yeah.
Just carry on.
અને જેને ગુજરાતીમાં અને હિન્દીમાં ડૉક્ટર શીનાએ જે વાત કરી છે હું થોડી વાર પછીથી એને ટ્રાન્સલેટ બી કરીશ એટલે जिनको जो समझ में नहीं आया अंग्रेजी में और जिनको जो पता चलना चाहिए वो मैं आपको बाद में बताऊंगा.
Yeah, that will be really good. I'm just going to check we've got Nita back. Nita, are you back with us?
Can you hear me?
Yes, we can. Do you want to continue?
Yeah, so sorry, I don't know what's happening with technology. I've gone into another room now, so let's hope this works.
Yeah.
Okay, so Dr. Sheena's just explained the difference between type 1 and type 2. So yeah, that's at age 10, I realised injections for the rest of my life. But again, I was still lucky. Dad took over the whole regime for me. And in those days, the regime was really, really difficult. We had the glass syringes and the metal needles that were extra thick and testing your urine and all of that. But like I said, my dad became my best buddy and he did it all for me until I became a teenager. Went to university and wanted to start going out. Obviously, you go out, you go for meals. And that's when it hit me that I am different, in all honesty, because who wants to eat at 6 o'clock in the evening? And that's when I had to have my dinner because my insulin required me to eat. It could have got a little bit depressing, but I had some good friends around me and they understood and they worked around me. So things could have been bad, but I've been really, really lucky with my positivity and the good friends I had around me. That's whilst I was growing up, all that was happening around me, but I didn't let it get to me mentally, let's put it that way.
So were there many kind of adaptations you had to make, or was it all just sort of managing your time and alerting your friends? Like you mentioned, you went to university. Did that, having diabetes or anything, did that impact or anything? Or it was just making small lifestyle changes and just getting on with it, I suppose?
I was saying, I'm quite a positive person. One thing my dad drilled into me when I was age 10 is, look, there's nothing, you're not that different. Count yourself lucky. You can do everything unaided. If you're not in a wheelchair, you've not got a limb missing, etc., you can lead a normal life. The only difference between you and a non-diabetic is you're going to have to take your insulin every time you eat, basically, in a way, to keep you going. So that grew with me as I was growing into a teenager, and it didn't stop me from doing anything because I always thought, no, it could have been worse. I could have had other kind of ailments which has stopped me leading a normal life. So, little lifestyle changes. But apart from that, my positivity stayed with me, and I've done everything I've wanted to, and I'm still doing everything I've wanted to.
Yeah, and I think the positivity shines through your voice, actually.
But the one thing about being Asian...
Oh, I think we've lost...
She's gone again.
Lost her again.
Could I just add, Bhavini?
Yeah, sure.
As a teenager with type 1 diabetes, it is a very risky time because as you try and... the developments of being a teenager, wanting to be more independent, being able to control your own life, can take over the strict, needs of a type 1 diabetic. And many a time I have seen patients who've not been able to or didn't want to control their diabetes during their teenage years.
Yeah.
And now they regret it because obviously throughout those years, the changes that can happen in other parts of the body have happened and can be irreversible. So it's really important to support teenagers in their time of, becoming an adult when they want to do things for themselves and not necessarily listen to authority.
Yeah.
Yeah, so it's a very vulnerable time for them and they need a lot of attention.
Yeah, and I think Nita alluded to the support from her father, how she's been able to actually, really make the best of her life in terms of education, going to uni, being independent, but having that support by the professionals and her family to actually ensure that she has her injections taken on time and that she is able to actually do everything else like she said. So I think that's very important. Nita, are you back?
Can you hear me?
Yes.
I don't know what's happening, so sorry.
No worries. Was there anything else you wanted to share?
I just need, because we're talking, South Asians, and I am Asian, Indian. One thing what happened to me as I was growing up was the marriage market. It was a big taboo in those days to talk about diabetes. And I'm hoping programs like yourself, like this, people are going to be less scared of talking about diabetes. It doesn't matter how old you are. Share, find out things. Don't be scared about talking about it. There's nothing wrong with you. It's not a catching disease. So don't try and hide it and shy away from it. Embrace it and learn to live with it, because it sure can be done.
Yeah, it's a good message to get out. Yeah, no, definitely.
One more thing I wanted to say. I'm part of a voluntary organisation called SAHA, South Asian Health Action. And one of the branches that we focus on is diabetes. And the motto we have on there for diabetics is, don't let your diabetes control you, you control it. And if people can try and get that into their mind, don't let the diabetes control you. You can control it with changes in your lifestyle, and you will have a loving relationship with your diabetes as you go through life.
Yeah, no, yeah, definitely. We've got a few questions, and I guess I'm throwing them out to any of you three that are able to answer them. One question is, I've had diabetes for a few months, and I've been put on metformin. However, every time I start to take my tablets, after a few days, I'm feeling sick and nauseous. I don't even feel like eating. And then I stop taking them. A few days later, once I feel that my stomach is, not feeling sick, it's aligned, I start taking my tablets again. And then I feel as if I'm either constipated or have diarrhea. Could this be a side effect of metformin? I have spoken to my diabetic nurse, and she said it's normal, just carry on taking them. But I honestly feel really sick. What would you say to that?
Shall I answer that question?
Sure, go ahead.
All right. Metformin actually is the primary drug which is being prescribed to control the type 2 diabetes. However, it has got some side effects, and some people react very badly to it. And if these people cannot tolerate metformin, it should be discontinued, because there is no point in keep on giving a drug which causes actually other miseries. Basically, it is sometimes, it creates severe diarrhea, uncontrolled diarrhea. It also creates sometimes kidney problems as well. And it also has a sort of an allergic reaction as well. And if the patient is going for a surgery or etc., it should be avoided. So there are quite a number of reasons. And whenever we have spoken about metformin dosing, especially with diabetic nurses, unfortunately with the NHS and there are certain guidelines which has been drawn up, and people tend to stick to the guidelines, and metformin is in the first guideline. And that is one of the reasons why nurses keep on saying, okay, it will settle down, it will settle. But in some people, it just doesn't settle down. And there are alternatives now available. So that particular patient should be taken off metformin and should not be given metformin.
So is there an alternative medication they can be given, or is metformin the only one?
No. There are quite a number of different drugs which are available.
Okay.
And about 12 years now, 12 or 15 years ago, a gliptin class of drugs were introduced for type 2 diabetes, which actually helps to stimulate the pancreas or the islets of Langerhans, which Dr. Sheena George mentioned, to stimulate those beta cells to produce insulins. And it is taken only once in the evening, this particular drug, and it works for 24 hours. So, and it has been very successfully being used in quite a large number of patients. And even in those patients who were on metformin and were reacting to the higher dosage of it, so the dosage of metformin was reduced in these patients, and gliptin was an added drug for management of diabetes. So actually a good diabetic nurse or a good diabetic consultant or even a good diabetic GP would be able to adjust the dosing for the patient.
Fantastic. So Syed, that was a question by Syed. So Syed, if you're listening, go back to your diabetic nurse and, just query about alternatives, because, there's no reason why you should stop taking your medication if this one is not suiting your body. There are other options available. Another question is, who would like to remain anonymous? I've been diabetic for over 5 years and I really don't want to take my tablets. Is there any alternative methods I could take in terms of perhaps Ayurvedic medicine, herbal medicine, or perhaps yoga poses? Can this help in reducing my sugar level numbers?
Could I take it?
Both, yeah, whoever wants to go first. Dr.
Go on.
Sheena, yeah.
Basically, I think you should try and keep taking the medication until the blood test results come back to normal. And you can modify your lifestyle. The main driver is what you eat. It's not anything else. It's what you eat. So as we discussed, try and avoid all refined carbohydrates and sugars. You should still take carbohydrates, but in moderation and with as much fiber as possible. And you need to exercise more, even if it's just walking for 10 minutes a day, brisk walking. That will help. And you shouldn't really stop your medication until you work with your family doctor or your diabetic specialist and make sure that all your blood level, sugar levels return to normal. And the other measure of diabetic control is something called the HbA1c, which checks the average amount of glucose in your blood over the last 3 months. When that returns back to the normal range, then it would be a time to discuss with your doctor about reducing or even stopping your medication. But it is possible to do that, but it's all based on diet and exercise more than anything else.
And Subhash, uncle, you wanted to come in on this?
Yeah, I've come across this situation quite a number of times. Amongst even my friends as well, who have been diagnosed with type 2 diabetic, and they just refuse to take the tablets because they think, and हमारे में क्या है कि गुजराती में और भारत में और इंडिया से जो आते हैं उनको ऐसा लगता है कि आयुर्वेदिक मेडिसिन इज अ कंप्लीट क्योर और यूनानी मेडिसिन इज अ कंप्लीट क्योर. बट प्लीज रिमेंबर, आपका जो डॉक्टर जो है, डायबिटिक डॉक्टर और डायबिटिक नर्स जो है, या तो आपके डायबिटिक कंसल्टेंट जो है, जो आपको सलाह देते हैं और आपको जो मेडिसिन प्रिस्क्राइब करते हैं, उनका मतलब ये है कि आपका डायबिटीज कंट्रोल में हो. और जैसे डॉक्टर शीना ने अभी बताया कि टैबलेट कम करने की आवश्यकता हो सकती है. कैसे हो सकती है? जैसे आपकी लाइफस्टाइल चेंज करे, आपका खाने पीने का जो व्यवहार है उस पर कंट्रोल रखिए, आपके डायटिशियन के साथ बात कीजिए. लेकिन there is a request from all of us, please do not stop taking your medicine abruptly. It's not going to help you.
Another question has come from Josh Naben, and she is asking that she has another eye condition. Now, it doesn't mention what the other eye condition is. However, she also has diabetes. Now, she has lost all of her sight, and she's now wondering whether it could be to do with her diabetes, or is it her eye condition. She goes to visit her eye hospital once a year, and it's never mentioned to her at all that she has diabetic retinopathy or diabetes, or it's never been picked up. Can she now find out what could be the cause of her sight loss?
Yes, I'm sure she can.
Okay.
It's important to make sure that she has these questions prepared before she goes for her appointment. Or even instead of waiting for her appointment, she can contact the hospital and send a message to the relevant doctor she is under to contact her to explain what the condition is that has caused her sight loss. If they haven't picked up diabetic changes at the back of the eyes, it's unlikely that it's diabetes that's caused the problem. It could be the other eye condition.
Okay, so yeah, no, that's great. So Joshua Ben, if you are listening, and I will come back to you all with your responses, please get in touch with your hospital and request that information. And the final question I have is, I have got diabetes. I was diagnosed a few months back. But I'm struggling. I'm struggling with knowing what to eat, what I can, what I cannot eat. I don't know what my right portion sizes are. I have been referred to a dietitian. However, I work full time and the appointments are just given to me, so I've not been able to attend any of them. And now I've been taken off the list. I'm really worried. My levels, so here it says my levels are between 11 and 15, and I can't seem to I can't seem to reduce them. Is there anywhere else that I can get advice on in terms of what I should be eating, what's right for me?
This is Dr. Sheena George here again. I think it's really important that you get advice targeted to your individual circumstances. And the one great advantage of being in this pandemic is that things can be done by telephone or by video consultations in the time that is convenient for you. So a lot of GP surgeries, if you're based in the UK, now do telephone consultations, and they make sure that you're able to attend those consultations. So you can speak to your family doctor and ask for the dietitian to call you at a convenient time to discuss all your requirements, what you actually take now. So it's good to write down a food diary of what you're eating and how much exercise you get, so a daily diary, so you can have that in front of you when you speak to the dietitian. They do have diabetic specialist nurses as well that will have a lot of this information. They're actually extremely experienced. And if I don't know if you're in London or in an area where it's very multicultural, but these specialists will have knowledge of all types of cuisines and how best to, ensure that you control your diabetes as well as you can.
Yeah, no, I think that's very useful and helpful.
Bhavini?
Yeah.
Sorry, Nita here. I don't know where the question, where the lady is from, but if they're from Leicester, even if they're not from Leicester, because we're now doing Zoom calls, if you search for SAHA, South Asian Health Action, on Facebook and message us there, we have regular meetings, and there's lots of diabetics on the calls, and they learn from each other.
Yeah.
Is bajran or rotlo better for you than a rotli and stuff like that?
Yeah.
So, join us. Like I said, because Dr. Sheena's just said, due to the pandemic, we are doing Zoom calls now. But if you're talking to people that are already diabetic and they are controlling their diabetes, it's good to learn from them as well as the professionals. So, yeah, look us up on Facebook and contact us via there.
Yeah, no, I think that would be very useful. I think also just talking to somebody else that's, going through the same as you can actually be a really good sense of support. Like, it can be quite emotional. It can be quite a big change. But, with, talking to other people that are going through the same, getting the right support, attending your appointments and getting the professional advice, you've outlined and that you can actually live as normal life as possible, just making those adaptations, and you can be quite healthy, if you take your medication and go to your appointments and just manage your care plan basically, and that's fantastic. And they want to remain anonymous, so I respect that. So if you're listening, do search up South Action Health Forum, and you said on Facebook and on was it just Facebook they can look you up?
That's the best way at the moment.
Yeah.
We are on Google as well, so they'll find our details on Google as well. South Asian Health Action, SAHA for short.
That's fantastic. I'm afraid we've got to leave it there. We're at the end of the show, and there is so much more we could have talked about, but what we have shared by yourself, Nita, Dr. Sheena George and Subhash Uncle, translating it in different languages, it's been very useful, and I hope people listening have been able to get reassurance and a little bit of insight into that please do attend your appointments. Do manage your condition, because then only then you can, like Nita, you said, don't let diabetes control you. You control it, and you can live a very happy life. So thank you to each of you for coming on today and sharing your knowledge, and Nita, your experience. We're going to leave you with this final song. Anita, you mentioned your dad was a great support. So this song is dedicated to your dad. I do want to wish my dad, it was his birthday yesterday, so happy birthday to him. And it was International Men's Day on Thursday. So, this song is for all the men out there. Goodbye, and see you next Saturday at 10 o'clock.
सब यार अपने सबके दिलों में अरमा ये है बैठे हैं मिलके सब यार अपने सबके दिलों में अरमा ये है वो जिंदगी में कल क्या बनेगा हर एक नजर का सपना ये है कोई इंजीनियर का काम करेगा बिजनेस में कोई अपना नाम करेगा मगर ये तो कोई न जाने कि मेरी मंजिल है कहाँ पापा कहते हैं बड़ा नाम करेगा मेरा तो सपना है एक चेहरा देखे जो उसको झूमे बाहर मेरा तो सपना है एक चेहरा देखे जो उसको झूमे बाहर गालों में खिलती कलियों का मौसम आँखों में जादू